The other problem we find, or a problem we find with people with persistent respiratory symptoms, is they sometimes get the wrong treatment and a delay in diagnosis. And that can be really frustrating, and it's knowing how to tackle that part of the system. So my advice would be that, firstly, when somebody asks you the questions first time around, they're quite fresh questions. You may not really know the answers. You may not have really thought about those answers until somebody asks that question. So if you need to be seen a second or third or fourth time, it's worth revisiting the whole history of what's happening and making sure you give that information to the clinician. It may be a different clinician you've never spoken to before, so it's really useful information. It may be the same clinician you saw previously, but two things can happen. Your answers can get better or more accurate or more thoughtful, and the clinician might well have forgotten the answers you gave last time and only made brief notes, which shouldn't be the case, but does happen. So each time you go in, it's worth just starting from the beginning and saying, I've had this cough, I've had it for 4 months, I've had 1 or 2 courses of antibiotics, I don't think they've made any difference. And then be really forthright and frank about what you think is wrong with you. So I don't think this is an infection. Could this be something more serious? Is this something that needs more investigation? Do I need a chest x-ray? So put that thought into the person's head. So even if they say, absolutely not, I've considered all that, absolutely not, it still is worth having that whole conversation. So it's around making sure you revisit the history. It's around being as honest and really accurate as you can about what's happening. And again, if you see one clinician and you feel that your treatment isn't appropriate, don't just sit back and say, well, they messed it up last time, I don't feel any better. It's about going back and saying, thank you for that treatment, but actually I don't feel any better, what else can we try? Just to make sure that your healthcare professionals are aware that you're there and that this is an ongoing problem. If they don't see you, they will assume that everything's better and you do not need to be seen. So it's worth just being persistent, making sure you talk through the whole thing and telling the person what you think is wrong with you, to put that idea into their head as much as anything else, and to let them know what you're thinking.